into my medication room. I'm going to wash my hands. I'm going to compare my doctor's orders against my MAR. My doctor ordered furosemide, 20 milligrams IV push now for edema. The MAR states furosemide, 20 milligrams IV push now for edema. I'm also going to compare my medication with the MAR. My medication states furosemide is 40 milligrams. After I get through doing the math, we're going to be given 2 milliliters. The reason I'm comparing it with my MAR is to make sure that those patients' rights, those 6 rights are done. That's the right time, right amount, right dose, right patient, right route, and right medication. I'm also going to check and see if my medication is compatible with my primary IV fluid. My primary IV fluid is normal saline, so I'm going to get my trusty dusty drug book and see if furosemide is compatible with normal saline. Furosemide, move over, and it is compatible with normal saline. I'm going to check my medication for any cloudiness, if it has any sediment, leakage, or anything like that in the expiration date, and it's not expired. I'm going to check for allergies on my patient, and my patient doesn't have any allergies. I'm going to check to see if it is a safe dose. So furosemide is given 20 to 40 milligrams. That is a safe dose. The dilution, it may be given undiluted, so we're giving that undiluted. And the rate of administration is given over 1 to 2 minutes. We're also going to check special precautions or anything that we need to monitor with furosemide since it is a diuretic. We're going to check our electrolytes, particularly calcium and particularly potassium and sodium, because we don't want to cause a potassium depletion and cause our patient to go in metabolic acidosis. And sometimes supplemental calcium might be needed. We also want to monitor their blood pressure so we can make sure that they're not being hypotensive. We're going to monitor their blood and creatinine to make sure that they're not going in renal failure. We're also going to monitor for signs and symptoms of fluid or electrolyte imbalances like a dry mouth, weakness, dizziness, arrhythmia, drowsiness, nausea and vomiting, hypertension, lethargy, and muscle cramping. And I'm going to instruct my patient while I'm giving this medication and after if they have any signs and symptoms of any adverse reactions, such as they having a flush or a rash or difficulty breathing, if they feel like their throat is swelling or their tongue is swelling, to hit the call light so the nurse can come in and intervene. Now that I've done all that, I'm going to get ready to administer my medication. I'm going to make sure that my IV site is patent. First, I got to assemble my equipment. So I have my Lasix here. I have my syringe, and I'm going to use a 3 milliliter syringe. 3 milliliter syringe because I'm giving 2 milliliters, and I'm going to have a flush. And even though they are compatible, I'm still going to flush that port. Okay. I'm going to wipe the hub of the syringe, wipe the hub of the Lasix. And since I don't have another 3 milliliter syringe in there, and this is already drawn up, I will put it in there, invert it, withdraw my medication where you can see 2 milliliters. Okay? I will gather all of that, go into my patient's room, and take my MAR with me. I will come in, I will wash my hands. I will introduce myself. Good morning, I'm Student Nurse Brown. I'm here to give you your IV push of Lasix, 20 milligrams for your edema that your doctor prescribed. I will identify my patient by 2 identifiers. I will ask them can you please identify your name and date of birth? My patient identified their name and date of birth. I will also ask them if they had any allergies. Though we asked it before, sometimes the allergies change, and my patient has no allergies. After then, I will check the patency of the IV. And the way I check the patency of the IV is that I will lower my primary IV. I will watch for blood return, which is blood return, and let them know that my IV is patent. I will check that IV site. I will make sure that there's no swelling, no inflammation, no redness, no blanching, no signs and symptoms of infection or evacuation or phlebitis or anything like that. And the IV site is patent. Now you're ready to give my medication. Wash my hands again. Put on some gloves. And I'm going to give that IV push close to the IMT site. So I'm going to go ahead and open my second flush. I'm going to clamp, even though I don't have to. And I'm going to pinch. I'm going to flush. I'm going to wipe my port off. For 30 seconds. And I'm going to allow it to dry. And it's dried. I'm going to flush with the normal saline. Over 1 to 2 minutes, because that's the way we're going to give the medication. It's pinched. And I'm using the push-pull method. Okay. Then I'm going to give my medication. And I'm going to give that over 1 to 2 minutes. And I'm going to use the push-pull method for that. We're giving 2 milliliters. We're giving 1 milliliter a minute. And that's 1 milliliter a minute. I'm going to flush again. Over 1 to 2 minutes. Because that's how we gave the medication. And I'm going to wipe my port again and open it up, unclamp it. Okay. Once I'm done that and make sure that my patient was okay, that they weren't having any adverse reactions, I'm going to clean up my supplies, dispose of it in appropriate containers, and I'm going to make sure to document my patient, the type of medication, the time, the route, how that patient tolerated it, and if there was any adverse reactions. Thank you. That's the IV push.